This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your phone calls on any subject you'd like to talk about. Number here is 888-630-9625. That's 888-630-9625. Love to talk to you. Let's kind of dig through the weeds. Perhaps you've had a problem. You've done everything you can think of. You've tried, you've applied all kinds of things. Well, guess what? It hasn't worked, has it? So let's fix it. Let's see what we can do to make a difference and turn and reverse the situation by your hand. Because, by the way, that's how you got into it. Some of the things that you did or neglected to do and ended up where you are. But the conundrum is that you don't know what you don't know. So that's why I'm here, to let you know what you do know. Listen, it's beautiful outside. It's a gorgeous day. Get outside and enjoy it. Have fun. The police officers are all over the place, so keep the speed under control because they want to slow you down. And you want to do that without a ticket, don't you? Got some interesting things in the news, and, every once in a while something jacks me up a little bit. It makes me crazy. And when you get a good magazine, and I call it good magazine because there's a lot of very significant contributors. It's called Life Extensions Magazine, and I read through it because I want to know what you all are listening to and reading and being influenced by and so forth. So I kind of flip through the pages, and if there's an article or two that I think that is important, I'll look at it, and I follow the threads relative to bibliographies and so forth. And then all of a sudden I get hit with something, and it catches my attention. And it sometimes says, yes, they're right on, and sometimes they're not. My opinion, Life Extension Magazine had started out to be a really intentional, for your health, good for you type of news release item in the healthcare industry, particularly in functional nutrition. Now, over time, what I've noticed, my opinion, is that they've begun to sell out. They have begin to just promote products. They want to sell their stuff, so to speak. And every once in a while you notice that there's somebody in the background. It sounds like maybe a drug company. And, they start putting out these things about this drug can be great for you. Well, there was one of those in recent issue, and I want to talk to you about it because, it makes me a little insane when I see stuff like this. And it's about a diabetes drug called Metformin that we've talked about many times. And it says Metformin may lower lung cancer risk. Really? So they go on to say that each year around 20,000 American non-smokers die of lung cancer. And it's a huge number. Obviously, we don't want people to die of any kind of cancer. So this is lung cancer, 20,000 people. There's more people than that die of car accidents on, a monthly basis. But according to the study that was published in a cancer prevention research, and remember, always ask the question, who published it, what do they have to gain by it, and who wrote the check? That's the most important divining rod that you have to look at. So you go through it, and they talk about this PhD, medical PH person out of Kaiser Permanente. So all of a sudden that tells me, okay, we got a drug-related situation, and they said that they did a study retrospectively of people that were on metformin between 1994 and 1996, and the conclusion was approximately 46% of them filled 2 or more metformin prescriptions within a 6-month period. Really? 2 or more. So is that it? So how often are they taking it? What was the drug? What were they trying to prove here? And then they followed them up supposedly for 15 years, and there was a whole bunch of people that were diagnosed with lung cancer, and 80 were non-smokers and 203 were currently smoked, and then they went on to say, well, metformin was not associated with a lower lung cancer risk overall. The risk was 43% lower among diabetic patients who had never smoked. Really? No kidding. No kidding. If you don't smoke, you reduce your chances of lung cancer. Period. End of story. So where does this metformin garbage come in. So they go on to say that non-smokers who use metformin for 5 years or longer reduced their lung cancer risk by 52%. Really? What is the measure? How did they do the study? And who has to benefit by it? Let me tell you something about metformin, okay? Side effects. It dramatically adds to B12 deficiency. It increases your risk of certain types of cancers. It causes problems with breathing mechanisms itself. And it goes on. It is unbelievable. And then they have the audacity to print something like that. And they list common side effects like abnormal stools, change in taste, and then muscle pain, and then difficulty breathing, which we talked about, lightheadedness, nail problems. That means that your nails get all screwed up and they don't grow and they get mottled and so forth. Flu-like symptoms. You want flu-like symptoms? Take metformin. Okay? Increased sweating, increased thirst. I mean, really, give me a break already. This is like the fox is in the chicken house already. And they're trying to get you to think, why in a functional nutritional journal would they even put that in there? I don't get it. Supposedly, in one hand, they're trying to change your lifestyles and show you that you can take nutritional products to help yourself out. And on the other hand, they're telling you, take this drug, it's good for you. Well, how about changing your lifestyle? How about changing the way you do? Get a little exercise, quit eating the crap that you put in your body, get rid of the carbohydrates, increase your proteins, increase your vegetables, start relaxing a little bit. Metformin may also cause a reduction of all kinds of nutrients. And we talked about B12 being primary. Now, here's the problem. When you have a B12 problem, there's other pathways that are going to be damaged, including your heart vessels, including your neurological transmission, including the way you think. Metformin can cause kidney problems and liver problems. And it goes on, and it decreases the function of other types of hormones. Metformin doesn't do anything well except drop your blood sugar. Now, does that mean that the problem with diabetes has been eliminated? Absolutely, positively not. So you go on and you start looking at the why behind this. Why are they doing this? Who wrote the check? Who's the one that decided that they were going to do this? Well, when you go in and you see where it was published, Cancer Prevention Journals, and this goes back, by the way, to this year, February 2nd, 2015, ask the question, this is not okay. What I want you to do is think through it and don't be duped. A good journal, I thought, years ago, now is being bought out. It's being sold. It's being manipulated. And there's some very, very good people that are on their peer review. Why are they allowing this to happen? I don't get it. Who's putting the $5 in their back pocket times how many thousands and thousands? 888-630-9625. 888-630-9625. Love to take your phone calls on any subject you have in mind. It's hot outside, and so am I in certain situations. Did you ever think about Pycnogenol? Well, it's another element that can change life a little bit for you. And here's another one of those things that was published a couple years ago, maybe a year and a half ago, in a very respected journal of neurosurgical sciences. And it revealed that Pycnogenol, derived from the French maritime pine bark, improved memory. Well, that's great. And improved focus and decision-making processes and so forth. And they said ages between 35 to 55. So the study goes on and says, in a study of 59 professional men and women, 30 were supplemented with 150 milligrams of Pycnogenol, and they said what happened was that they retested and they found that memory was improved, but they don't tell you how much improvement. Well, Pycnogenol is an antioxidant. It's one of those things that, well, if you decrease the oxidative stress damage to your body, anything is going to improve. But, by the way, they didn't tell you whether or not they also changed their diet. They didn't tell you whether or not they started getting a little exercise. They didn't tell you what all those things were involved. And then they have a footnote and says subjects given Pycnogenol showed improvements in certain mental, emotional patterns of mood and performance and sustained attention and subjective memory, so forth, and daily tasks. And they don't tell you a whole lot what happened with the study itself, how these people were, where they were, what they did, what they added to the situation. Anyway, I'm on a roll today, and for those of you who are out there, I don't apologize. This is one of those things that you really need to be aware of. Look at information critically. Work through it. Ask the question, who published it. You know, if there's a fly in the ointment, it's going to show up if you look at stuff. Don't believe anyone. My job is to provoke you, as I've said so many times, to stir up the pot, to make you interested in your own health, to make you aware that you have control, that your hands, your decision-making processes is ultimately what gets you from where you are right now to making things a whole lot better than what they were prior to now. Coming up in October, we have something that's very exciting, and we've been doing it for 15 years now. And what's that called? That's called Ageless Health 2015. And it's going to be on Saturday the 17th. Those of you who have been there before know, in fact, that this is a blockbuster day. It's one of those things that you really can't afford to miss if you want to take control of your health. Join me and a whole bunch of very top-shelf people on that Saturday. It's an all-day event, October 17th, and I promise you, patients have said this is like drinking from a fire hose, that you get way so much information. Our staff is going to present. Sue's going to be there. She's going to do nutrition. This year's program is on the brain-body connection. It's how your body reacts to all the neurological impulses and how your brain works and the mechanisms of that. It's an incredibly important, impactful production. Be there. We'd love to have you. We'd love to teach you. We'd love to make a difference in your life. Go to agelesshealth2015.com. Now, between now and the next month, you can save some money. Tickets right now are only $79. We provide organic lunch, all the lecture notes and materials. We give you gifts, all kinds of gifts. There's going to be vendors. We're going to put it together for you in a way that you can go home and really add to your wellness quotient. I promise you, this is a day you'll never forget. It's extremely impactful. And we change the information every year, so be there. Even if you've been there years gone by, don't let this one slide by. Make sure you're there with us. agelesshealth2015.com and sign up now. And by the way, if you've been there before, we have a special price for you right now, and do that before it runs out. agelesshealth2015.com. I'd love to have you there. I promise you, this is a day that's important. It's important to you. It's important to your families. 888-630-9625. Want to turn you on to one other thing that's important. We have a new website for you. It's called drtomrosellelive.com. That's drtomrosellelive.com. drtomrosellelive.com. Check it out. Let me know what you think. And always, if you want some information, if you'd like to talk to one of my docs, call us, 703-698-7117, or send us a note at one of our websites. RoselleCare.com is our main website. Somebody will get back to you. We will answer your questions. We will never, ever, ever neglect what we do for you on an ongoing basis. We're going to talk about the brain today. We're going to talk about how that brain works, but more importantly, how the brain reacts to injury and impact. You know, the majority of people who have minor lumps and bumps in the brain and injuries, they recover generally within a few days, up to about 10 days, a couple weeks. And, you know, if concussion signs and symptoms, continue beyond that point, you really have something that you have to pay attention to. But unfortunately, many patients aren't aware that they have a problem. Many patients aren't aware that that clunk in the head that you hit on your garage door or on your car door or on your trunk lid or coming up from underneath the table that made you see stars for a little bit, and then you do it repetitively. It's like your head is a homing beacon, and you look for things to hit. Well, we're going to talk about that, and we're going to talk about what happens and the damage and so forth. But more importantly, if you've noticed a cognitive decline, if you've noticed things that are starting to slow down, what you can in fact do about it so you can take control and get your brain back to work again. Okay? We're going to talk about that. Don't go away. We're coming up to a break, and we have to pay attention to some very important people who bring you Dr. Tom Roselle Live. This is Dr. Tom Roselle. See you in a minute. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio. 888-630-9625. That's 888-630-9625. That's how you find me, and that's how we talk. If you'd like to find us when we're not on the air, you go to RoselleCare.com. That's RoselleCare.com. And as I said, we have a new website for you. It's called drtomrosellelive.com. Check that out. Let me know what you think. We're going to answer your phone calls, and we're going to get back and we'll talk a little bit about brain, so give us a call and we'll handle things for you. Karen, thank you for being patient. How can I help you?
Oh, I have two questions, Dr. Roselle.
Yes, ma'am.
One is about the flu, and the other one is about that article in the Washington Post on the dangers of eating organic, vegetarian-fed chicken. I don't know if you saw that article or heard about it.
If it was published this week, no, because I've been on the road.
Yeah, well, you've got to read it. It's scary.
So you want to get me jacked up again, huh?
I knew you'd be able to defend it, but I'll wait.
Okay, I'll handle it next week.
Oh, great. And then I have the flu. I have the flu for the first time in 30 years. And 30 years ago, I got the flu shot, and I got the flu. Yep. I haven't had the flu shot since.
So you're a prime example of what I tell people all the time. The bug that gives you the flu is always around winter, summer, and fall. It just depends when your immune system is not able to handle it.
Right, and I was really run down last Tuesday, and I know I was under a lot of stress, had to get a lot done, and but I went to one of those pharmacy minute clinics because my daughter was visiting, and I developed a fever, and she says, "Mom, you better go see somebody. You have a fever." So the nurse practitioner, she tested me for pneumonia, strep, and flu, and I have the flu.
Karen. Okay, so let me tell you one thing. Fever is your friend. As long as you don't want to bring that thing down unless it gets way too high. What's too high for an adult? You start getting over 104.
No, I was like 101.9.
Yeah, you got a viral infection. Let it go. Just get wet, cold cloths and dampen yourself down and air dry it a little bit in your bathroom. Hop in a cool shower and then kind of walk around the room, and it'll drop it enough to you're comfortable. High dosages of ascorbate, vitamin C, and echinacea and zinc, and you take those every couple hours. There's a homeopathic called acetylum, which is specific for...
Oh, yeah, I have that.
You take that exactly the way it is. Get your diet down to a place where you're eating mostly vegetables right now and very light soups. Get the old-fashioned chicken soup going, and you'll pull out of it. You'll pull out of it very quickly. Just get a lot of rest and continue the process.
They gave me a prescription for Tamiflu.
I'll throw it away.
Oh, okay, because I took one last night and one today, so I'll just stop.
What I want you to do is go on the web and go side effects, warnings, Tamiflu, and see what comes up, okay?
Okay.
And it's going to make you crazy.
Oh, no.
So don't take it anymore. Go get the acetylum, take the vitamin C and the echinacea. Now, obviously, as long as you keep that fever under control. And
it's gone.
Okay.
It went away last night, and it hasn't come back.
You're going to be fine. Don't worry. And vitamin D is the other thing that you want.
I take those drops.
Okay.
Yeah.
Make sure right now you're getting enough vitamin D, probably about 10,000 units a day.
Oh, I have to take more. I think I'm taking 3 or 4.
Yeah, that's not enough for where you are right now. And actually,
taking lots of vitamin C, too.
Good. Keep it up. Karen, you're going to be fine.
Okay, thank you.
Appreciate the call. The flu is there all the time. It just depends on the state of your immune system. Karen is finding that out, and when you get stressed and when you do that kind of stuff, you become a problem. Joan, how can I help you?
Yes, I have a problem with atrial fibrillation. I've had it for quite a long time. And, of course, the first thing they want to give me is Coumadin, which I don't want to take.
Sure.
I had actually, I went in for bronchitis, and they ended up being more concerned over the AFib last weekend, and I ended up in the hospital. And immediately they put me on Xarelto.
Of course they did.
And immediately I got a bruise on my foot from it.
So, Karen, give me a quick question, because we're coming up to the halftime of the show, and I've got a couple of statements for you, and I'm going to direct you to do something. So what's your question?
Well, my question is, I need somebody, I'm in Montgomery County, I need a doctor in this area who follows your philosophy. Now, you're pretty much in Virginia, aren't you?
We are. And I'll send me a note, and I won't tell you over the air, but I will give you a recommendation of a couple people that are on that side of the Beltway. AFib problem can come from a lot of different things. You have to remember that the heart has multiple inputs. It has 3 neurological inputs, the pacemaker within the heart. It has the nerves that come from the spine. It has a nerve from the brain called the vagus nerve. If those guys are irritated, your heart's not going to beat normally. If you're not getting enough balance in potassium, magnesium, and so forth, that's going to cause a problem, and the firing patterns of the muscles of the heart are not going to do well. There's something called Ubiquinol, which is coenzyme Q10. You've got to have it at very high levels. Those are the guys that feed mitochondria within the heart. Those are your little engines that make things run really, really well. A lot of my patients, I get them very high levels of that, but you have to look at it multidimensionally. The nerve roots, the acupuncture circuits, and so forth, that can be turned around in so many cases. Everyone, no, there can be damage to the heart fibers, but you can thin the blood by doing lots and lots of things, but you got to get to somebody who knows what they're doing. We're coming up to a break. We'll be right back after some very, very important messages.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio on this absolutely stunning, gorgeous, almost summer-like day. Get outside and enjoy it. It's beautiful. Go for a walk, go for a stroll, go for a bike, go get your whatever. But get outside after you listen to me. We'll be done in a half hour, so just hang tight and then go outside. We're talking about several different things today, and we're talking about cognitive brain battering. Did you watch the fight last night? Talk about people getting their heads slammed around? Well, you know what? When you get your head beat up, regardless of whether you're a champion like Merriweather, or you're in a car accident, or you're playing ball, or you're underneath the hoops or whatever, and you bang your head on the closet door, or underneath the cabinet, or in the trunk, you have a problem, and you got to fix it. And you go into concussive states, and sometimes you're not aware that you actually had a concussion, but it lingers, and all of a sudden you notice that your language, you can't find words, your memory is not as good as it used to be, and you can't pay attention. Suddenly you develop ADD, ADHD problems, and spatial orientation and things of that nature. Can't solve problems. Your spouse or your significant other looks at you and say, "What's wrong with you?" So here's the deal. If you're finding those things, you need to do several things. You need to begin to re-educate your brain. But I'm going to tell you one primary thing. Do you know when you have brain injury, you know what your body needs? It needs water. Water. You know that thing that some of you think is just for washing? Well, water is necessary to rebalance brain function. And moreover, if you have stimulants like coffee, teas, things of that nature, it can cause things to get worse. So you need to avoid that. But dehydration ranges from very mild to severe and can cause all kinds of other problems and increase the damage from that injury. You know, many patients that come into our office drink things like, sodas and coffee by the pot full and things of that nature. Well, that doesn't do anything except make things worse over a period of many years. Nutritional protocols are very specific for improving brain function, and you need to do things like coconut oil, omega fatty acids, vitamin B12. That's just the beginning, but you got to get rid of all the other things that degrade, break down neurological transmission. And I could list tons of different things. They're specific for each patient, but you can take control. You can turn things around. You need to work with your brain with brain games. Let's just call it that way. You have to learn how to balance your body again. Get on a ball that allows you to wobble, and fires all the nerve roots into your spine. Those things are critical. And we're going to get on, we're going to talk a little bit more about how you can fix your brain when you bumped it too many times, you got a Band-Aid on it, and now it's time to figure out why you're not as well as you should be. Deanna, how can I help you?
Hello.
Hi.
I'm getting discouraged going to my orthopedic doctor about my knees.
Okay.
I'm 86 years old, and I have a difficult time, getting up from a chair, sitting down, going up the steps. I take one at a time. And he tells me the same thing. It's my age, and the cartilage is worse than it was on the last visit. And that's the end of the visit.
So let me ask you something. When you walk on a flat surface, do your legs hurt you? Do your knees hurt you?
No, it's mainly when I sit down and get up.
Okay, and when you walk
and
up...
go up and down the steps.
How about, is it as bad going down, or is it more so going up?
I believe it's more so going up.
Okay, so what that tells me, and obviously you're not here, I can't examine you and check it out, but what it tells me is that your thigh muscles, your quadricep muscles, aren't firing the way they're supposed to. They're a two-hinge muscle, one that goes over your front of your knee, and the other one that bends and flexes up against the upper part of your body. So there's a nerve that goes there. It comes from the middle of the low back, called the third nerve root of the lumbar spine, lumbar 3, and it causes that to fire. If that nerve has been irritated in any way, you can have loss of function, you can have pain in the back, you could have pain in the leg and back, you could have just inability to do things over a period of time. Now, in my business, in my specialty is called applied kinesiology, what we do is we recognize a relationship between organ systems and muscle function. So everything in the body is connected, whether it's your chest muscles, your leg muscles, your butt muscles, or anything else, by nerves and acupuncture systems and blood supply and lymph and so forth. In this particular system, the organ and the muscle that communicate together is the small intestine. So if the intestinal tract isn't working the way it's supposed to, then that muscle's not going to fire.
I have colitis.
There you go. So you have to clean up the intestinal system as well as fixing the neurological circuits, and then all of a sudden you're going to see that you're going to have a better outcome. The fact that you have a colitis type of condition tells me that you have an inflammatory reaction that's going to settle in the joint spaces. Now, if the muscles aren't firing the way they're supposed to, it's going to make it much worse. So you can get some help, and there's many other things you can do. If you're welcome to come down, talk to one of my docs. This is what we deal with all day long. We have, some great people that look at that. At your age, I would avoid surgery at every cost. I would avoid steroids. I would avoid some of the drugs that they use that would cause degradation. There are many other things that are possible to make you far more comfortable than where you are now.
Yes.
Diana, give me a call or send me a note. I'll be more than happy to take it the next step and help you. Franca, how can I help you?
Yes. Hi, doctor. My question would be, I have had vertigos for more than 4 years, and it comes and goes. It's not like every day, or it comes like every 2 months, 3 months. And I went to a neurologist, and he gave me Sonisamide. So I don't know if you know about that drug.
Yeah.
It's for
I do.
Epilepsy.
Yeah. Go ahead and tell.
And it's been working. I haven't had a seizure again, but I get a lot of headaches now. He said.
Well, that's
so I don't know if it's good for me.
That's a side effect, and it's one of those things that that comes with any type of drug that you're going to take. And unfortunately, if you look up any of the medications that alter or block or change any of the neurological transmissions of the brain, and that's one of them, the side effect is restriction of blood flow, and subsequently you can have the type of symptoms, the headaches, and there's many others as well. Vertiginous problems, a vertigo problem, comes as a result of either a ear problem, a problem with the upper part of the spine. If the first two vertebrae are not lined up properly, they're going to put pressure on the brain stem. They're going to put pressure on the inner portion of your throat, where you have two little tubes called the eustachian tubes that come off your ears and help you balance things. If there's inflammation in there, those things can get closed off. So there's many different pieces to look at, and particularly with something that comes and goes like that, it's not necessarily something that has to do, with a lack of medication or a medication deficiency. You have to find out what's causing it. If it was continual, if it was something that, you experience on a day-to-day basis, then you look at it a little differently. But in this particular situation, we would look at you structurally, we would look at you from an energetic point of view, but also, if it happens more in the spring, happens more in the fall, happens more in, all those questions are important. So, and then you look at, and you can break it down medically. You can talk about, postural vertigo, and then there's benign, and there's other things that, have to be looked at, like tumor formations, but I'm sure all of that's been ruled out for you. So you take the next step, and you look at, what really causes, when did it start? The causes of vertigo are what we talked about, everything from, the inner ear problem, and, when you change posture patterns, it can be a weakness in the adrenal system, or the canals that we talked about, or those eustachian tubes we talked about. It can be the position of, and there's even something called Meniere's, that is much more significant, and you can end up with tinnitus and ringing in the ears, and that goes along with the Meniere's problem, but that also can be liver function or kidney function. So you have to look at each individual situation, each person's problem, and treat it accordingly, not just throw a drug at it. Franco, I'm happy to help you at any time or refer you to somebody. I know you're out in Mount Airy. Just send us a note, and I'll see if I can find somebody out there for you. 888-630-9625. That's 888-630-9625. Love to take your phone calls on any subject you have in mind. We're talking about little things today, but more importantly, we're talking about bumps and lumps to the brain, just like all of us sustain on a day-to-day basis. And the problem is that we ignore them, and we don't realize that they're cumulative in many cases. We end up with scar tissue. We get lost with neurological transmission. So what can you do to make a difference? How can you break those things down? Well, we talked about rehydrating your brain, and then we got into a little bit of talking about brain games. And, those are the tools to stimulate cognitive function. And basically what you're doing is you're challenging the brain's 5 major functions, right? Language, memory, attention, visual, spatial awareness, reasoning, problem solving. So you have to say, where's things broken? And then what you do is you put games, if you will, activities, challenges in to stimulate re-imprint brain pattern. The brain is plastic. It's very moldable. And you can begin to reinstitute function, and it's broken up into holograms, meaning that each part of your brain has a picture, a mirror image of every other part of the brain. So if you stimulate what's good and what worked, it can compensate and pick up for even things that have been damaged. Years ago, the founder of our specialty, Dr. George Goodhart, passed away a few years ago. George was working with a bunch of neurosurgeons out of Boston, and they found that even with patients who had degenerative changes due to spinal cord fractures and trauma and so forth, could reinstitute much normal function by using antioxidants, low levels of things like selenium and low dosages of vitamin E and some other substances, and they stimulated the end portions of the nervous system, which would cause the upper motor portions of the brain to work better. So by doing things simply like getting on a wobble board, and trying to balance. And if you can't do that, put 2 pillows on top of each other and stand and just kind of walk slowly in place on top of 2 pillows, holding on, to something so it keeps your balance. Then if you can go get a Bosu Ball, many of you have Bosu Balls, many of you have seen them. What it is, it's a half round ball and it has a platform on one side. So what you do is you stand again on the Bosu Ball and just hang on to something. So you just walk gently on it. Then when you really get good and you find out that you're doing better, flip it over and stand on the platform and do the same thing, and pretty soon try to balance yourself. The long tracts of the spine connect to the brain, and by stimulating the lower portions, you will stimulate the upper portions. By stimulating the upper portions, you will stimulate the lower portions. If you rub your feet, just get in and massage your feet. Use a golf ball to roll your feet, and not a foot roller, but a golf ball, because it gets into all the crevices. Go up and down and back and forth. It will stimulate the upper neurological receptors as well. Trying to touch your thumb to all of your fingers on your hand, back and forth from the next finger, and then your middle finger, then your ring finger, then your little finger, and do it back and forth as quickly as you possibly can. You're going to notice when you first start that it's going to be a discoordinated effort. It's going to be hard for you to do that. But if you do it repetitively and you keep at it, you will stimulate the both patterns of your brain. I have patients who have very cognitive difficulty in many different situations, from Alzheimer's to just dementia problems and so forth. And I find out which side of the brain is not working the way it's supposed to, whether it's the right side or it's the left side. And then I have them do things that will coordinate and reinstitute normal patterning, such as, let's say if the right side of the brain is not working, that is your artistic side, that's your musical side. That's a side that, really doesn't have the words or definitions to them. So you take your left foot, you hold yourself with your right hand, if you can't keep your balance, and you draw figure eights with your toes in big spatial open areas. So, and you go one way and then you turn around and you do the figure eight in the opposite direction. And you do that not a number of times. You don't want to count them until your body says enough, I'm done. And then you can go back and do it again. If you do it 2, 3, 4 times a day, I promise you that you will see changes. If your left side of your brain, you're losing cognitive patterns, start doing detailed things. Start working with small, easy puzzles, even going back to the levels of a child, and re-educate your brain. Do things that will help it, that will stimulate it, that will make a difference. Just don't sit there and say, oh, I'm getting old, what do we expect for your age? When somebody says that to you, walk out of their office. Go away. They are not there to help you. They're there to serve their own purpose, whatever God's name that is, I have no idea. But run, don't walk as fast as you possibly can to somebody who is willing to help you and make a difference. Whether you're 8 years old or you're 88 years old, it doesn't make any difference. There's always capacity to improve, providing that you're willing to do what is necessary, and you have to take responsibility. We're coming up to a break, and we'll be right back. We're here at 888-630-9625. Don't go away. You're listening to Dr. Tom Roselle.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle live every Sunday at 12 noon, right on the dial that you're paying attention to at this moment. Don't forget to tell your friends about where we're at, because we're here to help you. That's the whole purpose of this program, is to do as much as humanly possible to trigger your own interest in your own health, because your health is a do-it-yourself program. And as you know, the title of my book, so get out and buy it so you can use it as a manual to go through it page by page, make notes, and then ask me how to implement, and we're happy to do that for you. 888-630-9625. How you find us when we're not here is 703-698-7117, 703-698-7117. Go to the website that we just created for you for radio listening for this program. You can find all of our past shows there as well. Go to drtomrosellelive.com, and if you want to re-listen to this show, it's going to be there. It'll be posted in a few days. And we'll set it up for your listening pleasure so you can get back in and you can check it out and say, hey, listen, I forgot about something, and it's going to be there for you. Talked a little bit about vertigo. We talked about brain function, and we talked a little bit about stupid things in the news today. But more importantly, we want to make sure that you have the tools to help yourself. So if you have a brain injury, like the Pacquiao and Mayweather fight last night, and Mayweather won, many of us have our own opinions of what should have happened, but nevertheless, they both took some punches. And when you take those kind of beatings, your brain gets knocked around in that cavernous place called your skull. And they're sore today, and they have bumps and lumps that have compounded on their bumps and lumps that they've taken over the years. And they need to do some things to help themselves and at least hydrate as best as humanly possible. They need to do low exercise at this point, like yoga, like Tai Chi, nothing heavy, nothing that is going to, stimulate their body. They have to calm it down. They want to gently keep the blood flow normalized. They want to make sure that they can get rid of carbon dioxide, not add to it. So very, very gentle stuff for the next couple, 2-3 weeks until their body begins to repair itself. High levels of omega fatty acids, as we talked about. Omega-3s, particularly. The DHA and the omega-3 is what's important for brain function. Coconut oil, they ought to be putting it on their vegetables and making sure they eat that. High levels of vitamin B, we need to get that done as well. B complexes, particularly B1, B2, niacin, and B12. B12 is critical, along with high levels of folic acid. And if you have an MTHFR problem, which means a conversion problem of folic acid into folate, you want to get one that is only folate so your body can use it. Jeff, how can we help you? Thank you for calling.
Yes, hi. My wife has been dealing with myofascial pain and a lot of different other things related with back issues, like just nerve firings in her back, all stemmed from an earlier accident years ago. But
Jeff,
it just never seems to get better.
Okay, real quick if you can. I got a minute left, and I want to answer your question. So in about 15 seconds, what kind of care has she had?
Organic things that we could be looking at to help her feel better.
Okay, so the first thing, if I was going to advise you or anybody else, when you have any kind of structural injury, you want to look at the realignment of the spine. You want to decrease the neurological irritations. You need to get to a chiropractor, an acupuncturist. You have to change dietary patterns. You got to get off the things that are inflammatory and cause the body to degrade and break down. If you don't do that, then the problem begins to persist. As soon as you have a joint space that is off center and the mechanics of it are no longer normalized. So now you have.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.